Go ahead.
Hi, we'll be starting shortly. Just letting a few more people find their way in. Welcome. Welcome to Pacific Center for Lifelong Learning. I'm Cynthia Nypris from Continuing Ed and Career Services at Pacific College of Health and Science. You are at Streamlining Your Practice with Software Tips and Tools with the Jane team, sponsored by Jane, featuring Lauren Chow. Thank you to Rob Nadeau, our operations manager, and Julian Ruiz, our tech host as well. And thank you to Megan Walker from Jane. We are recording this webinar, so if you want to review it again, you can do that. And for those who weren't able to make it, it will be available on the Pacific College of Health and Science YouTube channel. If you are a Pacific College grad, there will also be a link to this talk in PCAN, the Pacific College Alumni Network, in the Practice Management Resources. If you have questions during this webinar, you can put them in the chat and we'll pass them on to Lauren and she'll be able to address them perhaps as we go along and certainly when she stops for questions. Let's start 2026 strong with tips and tricks to optimize your practice, time-saving workflows and tools to streamline your day-to-day so you can spend more time doing what you love. Please welcome Lauren Chow.
Hello, everyone, and thank you, Cynthia, for the introduction. Pacific College students, alumni, I'm so glad that I'm able to speak with you today, talk about some of those tips and tricks that software can bring to help streamline your practice, make everything run a bit smoother, a bit quicker as well. To give a bit of background, I work as the education specialist here at Jane, so I have the pleasure of working with many schools who use Jane in their teaching clinics, in their classrooms. So I'm glad I'm able to speak with you today. To give a little bit of context of where we're coming from, at Jane, it is obviously a allied healthcare software. We're not going to do a deep dive into Jane today. We're going to be talking more broadly about practical tools and approaches that you can use to save time. Now, because we have access to a Jane demo clinic, we'll occasionally use it to bring these ideas to life. But the overall focus is going to be on those concepts and workflows that apply no matter what software you are bringing. As I mentioned, you're not seeing my screen. That's all right. Let's go ahead and turn that on. And I just need permission to do so. But that's quite all right. We'll take a quick moment. Cynthia will gain access for me, and then I will have all of the power to share my screen, take control. Otherwise, I hope everyone's doing well and take this as a moment, do a quick stretch, let
Yeah,
some of that
we
tension
are
out of your
working, we're
shoulders.
You
working
should be
on
good
it.
now.
We're ready to rock? All right, let's share our screen here. There we go. Meet Jane. Now we have visual cues, and it's not just my face on your screen. Even better. So to set a bit of context, Jane's a practice management software. It's an electronic medical records platform, and it's designed with the intention to support practitioners in managing and in growing their practices. It's web-based, so it works across all devices. It's fully HIPAA compliant with tools like online booking, scheduling, direct insurance billing, customizable documentation and intake forms, integrated payments, telehealth, so something like this over Zoom, and more. A quick overview of our backstory. We were founded in 2011 in Vancouver, Canada by our co-founders, Ali and Trevor. Ali owned a multidisciplinary clinic and Trevor was a developer friend of hers. So when Ali was unhappy with her practice management software and realized most of her colleagues were using multiple different softwares, she turned to Trevor to build effectively Jane. Fast forward to today, we now support a community of over 60,000 clinics around the world, supporting many disciplines, including acupuncturists, like many of you are or will be. And from the beginning, we have made it a priority to listen to our community and build around what they truly need. Alrighty, today we're going to be covering a wide range of those streamlining techniques and tools. We're going to start with charting and intake forms, move on to AI Scribe, super topical, one of those really exciting features on the market now. We're going to talk a bit about integrated payments and then some additional tips and tricks. Now, we have saved time at the end for questions, but please do add your questions to the chat as they come to you. Don't let them float away into the ether. Write them down, pop them in that YouTube chat, and we'll be sure to answer them as they come up, if not at the very end. Also, a special shout out to all of our massage therapists, in addition to our acupuncturists. Where would I be without you? I'd have much more back pain. All right, one of the most, I'd say, time-consuming, one of the most necessary parts of practice that can easily spill into your weekends and evenings is charting. Now, by electronically charting, you're already saving so much time and money compared to paper charting. By typing, by using those keyboard shortcuts, dictation, lots of time saving there and money. You don't have to pay to store those files. You don't have to worry about if anything happens to a physical copy if it's stored securely on the cloud. Now, we can also take a look at some different softwares that allow you to build chart templates. What that does is it gives you a structure, gives you some scaffolding of what your chart should look like. That way, you're not thinking each time, what do I need to include? You can see every section that you need to include. It gives you a structured starting point and reduces decision fatigue and repetitive typing. Your chart templates, they can also support compliance by ensuring that required fields and documentation standards are consistently met without having, of course, to remember everything. Consistent charting makes it easier to review patient history and collaborate with other practitioners, which ultimately supports the continuity of care. I'm going to swipe on over to Jane real quick, and let's take a look at what it means to build out a chart template, what it means to use one. So if we're looking at our templates here, at least in our system, you have two options. You can build out a template by yourself. You can go into creating a new template and add these individual components. So if you want to add in, first it's going to be a note box, and then it's going to be a multiple choice questionnaire. Absolutely make it work for you. Another option is to not reinvent the wheel, to see what other RMTs, what other acupuncturists are using in their practices. Let's hop into the template library here. We have thousands of templates shared by practitioners. It works for them. They want to share it with the broader community, and we can gain from their knowledge. Let's click into the acupuncture discipline here and see what we have. This one is a template for building out an intake form. So maybe before you're even seeing that seeing that patient for your first visit, you're giving them these questions, and they're doing it at home to give you that context, that health history. Otherwise, here we have an acupuncture charting note. Looks like we have a whole bunch of different symptoms here, a body chart, a pain scale. So why don't we go ahead and add that template to our collection? Now we have that acupuncture chart note. You'll want to look for something that allows you to make everything customizable. So I can come in here, even though this is someone else's template, I can edit it. So let's say I'm wanting to add a couple more symptoms here. I can scroll down and add an additional one. So let's say tummy hurts. Not fun. Not fun. Tummy hurts. Maybe that's a symptom that your patients are facing. We'll go ahead and save that, and that'll become a template that we can use in our clinic. When we go to chart and we hop up to our patients, I'm going to grab, let's say, Amelia here, hop into the charting area, click new chart entry. Similar to building out a template, you can go and select these individual components or use these pre-existing templates. I'm going to quickly sign in here as Susan, who is our RMT. And that way we're able to use one of Susan's chart templates. Here's that acupuncture chart note I spoke about earlier. We also have an RMT post-treatment note as our chart template. So you can come in here and enter in our chief complaints. We can use a body chart to mark where their chief complaint is. So let's say right shoulder, and this hurts. No good. A handy little tool that electronic charting allows you to do is use shortcuts. So let's go ahead and use one of our phrases. I'm going to start typing out the word for prescription, and that'll populate out to this little paragraph here. So if there's something that you're typing often, it can be handy to save that as a shortcut. Another benefit of electronically charting rather than charting on paper. Let's do another one here, DOB for date of birth. We can do plan of care. And as long as these are customizable, you can build out as many as you need just to save your hands, save your wrists, and save time. If we come down a little bit further, some softwares will also offer a smart options charting tool. So let's say this client came in and they explained that they experience some of this pain when they're running. So maybe they're experiencing mild pain while running, mild pain while standing, but no pain while they're sitting. This Smart Options narrative tool is going to turn that into a narrative. So the patient experienced mild pain while running and standing. I didn't configure this correctly, but you get the idea, especially if you're more tech savvy than I. All right, let's go ahead and sign that chart. By signing it, locking it, we're keeping it compliant. If we were to make any edits in the future, those edits would be in the form of an amendment. And that keeps it secure. So we signed it today. If we come back in a couple of weeks, we can amend these notes. We can add some additional notes, but it will be noted as such. It'll be noted as an amendment. Alrighty, I'm gonna pause here for a quick moment, see if we have any questions. Can we remind ourselves, did you sign? Great question, love that. And there are a few ways that you can remind yourself, okay, did I sign my chart or not? Looking at this example here, something that Jane does is we will pop a little locked icon next to the appointment if you've signed a chart. If I were to just start a chart entry, leave it in draft mode, I get that unlocked icon. And once I lock it, I will have a fully locked icon. So that can be a really easy visual tool. At the end of the day, you're able to just scan. As long as all of your appointments have those little locked icons, you know we've locked all of the charts. We can also take advantage of chart entries widgets. So if your software has a dashboard such as this, you can take a look and see where your chart entries are at for the past 90 days of appointments, how many of them are signed, drafted, and how many are not started. So I see that there's one chart that isn't started. That lets me know in the past 90 days there is an appointment that doesn't have a chart. I'll want to go back and fix that. All right. Can you still get in to edit if locked? Great question, and that is where amendments come in. So if I hop into a drafted chart entry that isn't locked, isn't signed, I am able to make edits. But this one here, this one is signed. This one is signed. It has a timestamp, it has my signature, and if I scroll down here, I'll see it's been signed by Susan Lowe, January 13th at such and such time. So I'm not able to go and directly edit the chart, but I can add those amendments. So let's go ahead and we're going to add another one up here to the chief complaint. We forgot to note that it's both shoulders. It's right shoulder and left shoulder. I'm going to come down and click amend. I'll scroll back up to the section I want to make an edit on, and we'll insert an amendment. So left shoulder and right shoulder. There we go. We'll do another signature. And what we see now is we see that amendment happening at 4:16 p.m. So this is entered into the official record. You have it there that it was left shoulder and right shoulder. You're being very thorough with your notes, but it's also HIPAA compliant. It's all the acronyms compliant because we're not going back and editing the original, or at least we're being very upfront with this is an amendment that I made in addition. If I scroll down to the bottom, I'll still see my original signature at 4:13 p.m. on this date. Right, great questions. I love that we're already thinking of those practical ways in which we interact with charts. And if any other chart questions come up, pop them in the chat. We'll make sure to circle back. Okay, next note, we briefly touched on this, client intake forms. So using those digital intake forms, huge time saver for both you and the client. You're able to reduce paperwork and admin time in that we're sharing the load. So it's not that every single time a client comes in, you're spending the first 30 minutes of your intake going through all of collecting their emergency contact information. They've already done that at home, so you can get directly into treating them. This is often one of the first touch points a client has with your practice, and it sets the tone for the entire experience. So if you let them complete it in their own time before they arrive, it really reduces those bottlenecks at the front desks and gives you all of that context, all of that health history information from the start. Now, when these tools are automated and linked to appointments, they become just a part of the workflow that runs in the background without anyone being responsible for them. What this means is if your software can recognize that a client has booked an appointment for the first time, send them out an intake form, notify them of it, remind them of it, that's not a task that you or your front desk staff have to take on. That runs in the background. So we're collecting that information, we're collecting signatures, agreements to your cancellation policy without it being anyone's, task to send out all these intake forms at the end of the day. Now, when looking at different intake form tools, we'll of course want to find one that allows you to customize templates. So if we can use one that's working for someone already and then just make those small edits, we don't have to start from scratch, but it can still be bespoke. It can still be tailor-made to your practice. If you want to bear with me for a quick sec, we can take a look at how intake forms work in Jane. So kind of similar to how we set up those chart templates, we can set up an intake form. So we have an intake form here, this intake form, January 2026. We're allowed to have it go out for specific treatments. We can have just a general health history intake form. It goes out for all appointment types. No matter what someone books, they're getting this basic intake form. They're signing off on consent to being treated. But we can also create additional intake forms. So if you have a specific treatment, let's say prenatal massage that has very specific consents, very specific questions that you want your patient to answer, you can create additional intake forms that go out for those specific treatments. So this one here, only if someone, let's say, books in for clinical Pilates, are they automatically going to receive this form. And then we can make it so that the questionnaire questions reflect that. Do you have any experience with Pilates? Do you have any injuries we need to know about? And of course, consents. So if, say, this is a form for treating sensitive areas, we can customize the consent so people are signing off on that. Now, these intake forms, they're going to go out automatically, tied to those appointments, depending on what you've set up. But if need be, you would have the ability to also send out those intake forms. So let's say we want to send out an additional intake form here. We can do so and add a message. Hello, please fill this out ahead of your appointment. There we go. Now that's going to hop over to your client's inbox, and it's going to be left on a pending status until they fill it out. Now, let's say the day comes, they haven't filled it out on the day of the appointment. You can always fill it out with them. So we can open that up in another tab, continue as staff member, and work through it with them. So if you have someone who doesn't have access to a computer, who needs a little bit more help filling it out, you do have that option of filling it out with them. And this is what the intake form looks from the client perspective. So first up, we're filling out profile information, demographic information, phone numbers, emergency contacts, all that great administrative stuff. If we jump to the next portion, we have the questionnaires. So what are your areas of concerns? Do you have any allergies? Do you have any injuries? Before finally coming down to, very important, the consents area. So in here, we can add in your cancellation policy. If someone doesn't show up, if they cancel super last minute, they agree to a cancellation fee. Once you have people sign off on that, you have something to fall back on. So if someone doesn't show up for their appointment, you can say, I have your signature here, you did agree and consent to our clinic policies ahead of treatment. Okay, so great time saver there, getting that admin work out of the way before that first appointment, and also having those intake forms just go out automatically in response to the types of appointments that are being booked. Looks like we have a new question in the chat. Is there any way to keep a note to myself that's not part of the official record? A note to myself to review the lateness policy with the patient? Absolutely. On each of your patient's profiles, we have an administrative notes section. So this is not part of the official record. If the client were to request their charts, this is not part of that. It is in a completely different spot, and often this is used for those administrative notes. So if I want to remind myself, remember to review policies, I can pop a little note on there. If I star this note, what that does is every time this patient books an appointment, we'll see that little note. The administrative team will be able to see that note. So let's say this person is always 5 minutes late, and we want to remember that. We can go ahead and star that note. And then if I hop to our schedule and we book a quick appointment for demo owner here, 30-minute appointment, no insurance, we see that little note and we see a little speech bubble on their appointment. They're always 5 minutes late. So I know I don't have to rush into the room because they certainly are not. Great. So I can remember not to put lavender oil in the diffuser if she's allergic. Yes, another great way to use that. So let's say allergic to lavender, we'll make sure not to put that in the diffuser, not to use any lavender oil when massaging. We'll star that and that'll be there on their appointment to remind you. Another great example. All right, so that takes us through intake forms, adding little administrative notes onto our client, our patient's profiles onto their appointments so we can remember important facts about them. Ooh, before I move on, another place that you can add that, if I just hop into the demo owner's chart here, we can also add a medical alert to their chart. So here is where I might say allergy to lavender, just to make it really, really obvious and visible in multiple places. All right, excellent. AI Scribe, certainly topical, a very exciting way of that practitioners are saving time. It's one of those tools that converts the words you speak, either from a recording or from dictation afterwards, into structured clinical notes. This means you spend far less time typing during a session and after a session, and more time with your clients. Personally, my doctor is saving hours a week through AI charting, and it makes a big difference because that's her Fridays, that's her weekend. So much more sustainable, and it also allows her to be present with her patients. Now, some AI note takers, they also allow you to customize templates to fit your note-taking style. So whether you're taking a soap note or a burp note, you'll want one that allows you to fit the tool to your style. Also, importantly, with AI Scribe, it's not replacing clinicians. Clinicians are still reviewing the notes, signing the notes. It is there to help draft the notes, but not to replace professional oversight. We're still wanting to come in and review what's been written, review that first draft, make the edits as needed before signing off. When you're implementing this type of tool, it's important to think about consent practices. So making sure your clients are consenting, they're signing a form that they agree to be recorded. You want to make sure you're complying with your licensing guidelines, that there is secure storage, and that you own those recordings. So you'll want to make sure the software is not using those recordings to train their models, that those are your property that you own. All right, now let's do a quick demonstration on how AI Scribe works. As I mentioned, two ways to do it. You can set it up so that it records the session, or you can use it as a dictation tool as well. And for our folks who are a little bit more hesitant with jumping right into a fully recorded session, I really recommend that dictation tool. So when we're recording the session, we turn on the microphone and we just let it ambiently record in the background. The recording is fully your own. You can set up auto deletion policies so it immediately deletes, or you keep it for a week and then it deletes. It is kept separate from the patient's charts, so if your charts are requested, the recordings don't also come with it. At Jane, our developers, they can't see those recordings, they can't see your chart notes. The only feedback they get is whether you give a thumbs up or a thumbs down to what is generated. So important to do your own research, make sure there's compliance with your licensing guidelines. But for those who are still just wanting to dip their toes, I encourage you to try it out as a dictation tool. If you find that typically you write rather scrappy notes during the appointment and then afterwards spend time making it all beautiful and, sorry, making it all beautiful, making it look cohesive, then that's somewhere where the tool can fit in. I'm gonna grab a bit of water. Get myself ready for the AI Scribe audio tool. So we'll go ahead and record a quick audio note here. We can see these dancing little bars letting us know that the microphone is picking up my voice, and we're going to start recording. And what I'm going to demonstrate right now is that dictation tool. So imagine I wrote some really scrappy notes. I'm just going to read them into the tool and see what it produces. So the client came in with right and left shoulder pain that is worse when they are lifting something, when they are using their shoulders to brush their teeth, reach up to grab a cup from the top shelf. They sleep on their back. We used an approach of manual manipulation as well as ultrasound. They are going to employ some take-home stretches and come back next week. It's my assessment that they have a mild sprain in both shoulders. So hopefully I stay employed at Jane because I don't know that I have a future as an RMT, but you can imagine that with your training, with your knowledge, your note taking, you can give it a much better example to work with. Nonetheless, even with a very amateur 30-second example, we see that it has taken some great notes here. So patient is reporting bilateral shoulder pain. It worsens with lifting activities, with daily activities like brushing teeth. They sleep on their back. We used manual manipulation. We administered ultrasounds. We assessed that it's a mild sprain in both shoulders, and our plan is to prescribe take-home stretches to follow up and continue treatment. So I might edit that one because I'm not sure if we're going to continue just the same plan or if we're going to change things next week. So I'm coming in here, I'm reviewing what's here and making those edits where I see fit. But we can see that instead of spending 15 minutes making these beautiful notes, we can use the tool to take our kind of messy charts and make them beautiful. Okay, we have a question here. Can you create, for instance, a My Mop template? So I'll be reminded about questions. Oh, okay, gorgeous. So yes, you certainly can. That essentially what's being asked here is if you're able to create a chart template that reminds you of the questions you need to ask, and you certainly can. So this soap note here, it was developed by the Jane team. If I click into this little AI Scribe tool, I see what prompt it's reading off of. I see that the format, we're asking for point form instead of paragraph, but I am able to edit both the prompt and the template. So I'm going to hop back to our little staff tab here, Susan. I'm going to hop to our templates and I'm going to find our smart soap note. So I'm going to perhaps leave these as is. I'm going to leave these prompts. I'm happy with them, but I want to be reminded about certain questions. So why don't we add some notes here? Maybe checkboxes, and I'm going to move the checkboxes all the way up to the top. And I'm going to edit these. Questions. If pain is acute, is it by activity, so on and so forth. If sedentary, what exercises are realistic? Here we go. And I might toggle on hide unchecked checkboxes after signing. And I can also add in maybe instructions here. So instructions, these will not appear in printed or exported charts. That's another great one that you can use. So if patient experiences X, ask about Y. Going to bump that one up to the top as well. And let's see the difference between whether this, this format or this instruction format works better for us. So I'm going to go ahead and save this template and let's call it PCHS. There we go. We've saved the template. We're going to hop back to our patient here, Philip, and we are going to access that template, PCHS. So questions, is pain worse when lifting arms? If the pain is acute, is it worsened by activities? So I can use these as a way of reminding myself, or I can use this little instructions here. And you can build this out to be longer. You can build it out to be bullet points instead. But that can be something that reminds me of what I need to ask. I'm going to go ahead and sign this chart and we'll see how it changes when it's signed. So I did ask the template to hide the unselected options. The unselected options are hidden, but I do still have that, that title of the section. I do see the instructions here. However, if I were to export this chart, let's go ahead and print it. I see that question title, but I'm not seeing those instructions. So instructions, it's looking like the winner here where you can remind yourself to ask specific questions, but if the patient were ever to request their charts, they're not also seeing that. Great question. Another thing to kind of remove all of that mental load, you don't have to remember every single question you need to ask. You can add those in as instructions. So you're asking them while you're charting, but it doesn't get brought into any exported versions of the charts. Right. If there's any more questions about AI Scribe, about building out prompts, something I think is really quite neat is using AI to make AI better. I mentioned before that our team built out the prompts that guide the SOAP notes. So if I open up this objective, let's go ahead and we'll open it up in the demo owners template. So templates are specific to their creator. If I open it up here, we see this prompt, a comprehensive subjective section capturing detail, blah, blah, blah. We can change these prompts. It does not have to be a SOAP note. It does not have to be this prompt. Something you can do is open up ChatGPT and say, I am building out a prompt for an AI scribe tool. I want it to follow this format. I want it to capture these details. Show me a prompt. It'll give you an example prompt. You pop it in here, you test it out, see if you like it. If not, you go back and you say, that was great, but I need it to focus more on patient health history. Use those tools to make these tools better. Okay, excellent. Next time-saving method here is we have, ooh, got a little buzzer beater AI scribe. Can I ask it to skip or separate the small talk? Absolutely. So if we hop back to Jane here, we're looking at the AI scribe. We're instructing it to capture detailed information about symptoms, about problems, pain, behavior, but we're not instructing it to capture anything about small talk. So if it hears talk about the weather, about how it's raining a lot in Vancouver, it's not going to also capture that. If you find that it is, we can add a separate prompt in here. Do not include small talk. So with this being customizable, you can also have it evolve and become better as you use it more and more. Alrighty. So integrated payments, why are they important? For our practitioners, they're running busy practices. It can take a lot of time to chase payments, to process those payments. Every hour on your calendar matters, and payments shouldn't take time away from your clients. Now, when you're able to securely collect and store payment information during the online booking process, you can reduce no-shows and late cancellations, and you can also make paying for appointments that much easier. If you have that credit card on file, someone walks out the door, you tell them, I'm just going to charge the card on file, and you're able to charge it without standing there waiting for them to e-transfer you or having to follow up a week later because they haven't paid you. Integrated payments, they allow you to tie your billing processes directly into your scheduling, directly into your client management, instead of having multiple tools, one for invoicing, one for card processing, one for reporting. An integrated approach allows you to keep that all in one software. So we're not hopping over to another software to download our billing report for the week. It's all in one, it's all speaking to each other. We also have the benefit of pre-appointment deposit. So you can ask your clients to pay an upfront deposit. You can ask your clients to pay entirely upfront, or you can set it up so that they're reminded. Say a few days go by and they haven't paid, you can get the system to send them out a reminder. It's not, it helps to depersonalize it because it's not you, their practitioner, having to remind them. It's the system, it's automated, and it's a quick, friendly reminder. Let's take a quick look at what that looks like. So I can hop into my online booking here, and I might set up a payment policy. I want to require a deposit. I want that to be a $10 deposit. In terms of your session price, it's a small percentage, but often when people put their own money on the line, they are more likely to show up. So we'll hop to our online booking page here and we'll go to book an appointment with Maya. We're going to do that initial visit. Now, Maya has locked down her schedule so that you have to contact to book. Let's hop to an acupuncturist instead, we want to grab that 3:30 appointment. Now, something a little funny is happening here, and that can happen when you have a shared demo environment. Everyone's customizing it and using it in different ways. So we're just going to double check our online booking, make sure everyone is happy, everything is allowed. And then why don't we just sign in as someone who books more often? So our demo owner here, we're going to hop in, go to our online booking site, and let's try booking with Michael. So we have this 30-minute return visit. I'm going to go ahead and book our 12 p.m. slot, and it's going to let me know that we're not quite done yet because we do need to provide some credit card information. This is my lovely partner who just popped in here. So we're going to provide some credit card information, which will allow us to put that $10 deposit down. Now, of course, using a fake credit card number, and let's set the expiry date into the future and set up a postal code. It doesn't like my postal code. How does it know that this is fake? There you go. It likes that one. We'll go ahead and we'll put that $10 deposit down. Payment paid successfully. I get a little option here to allow for email, text message reminders so that I'm not missing my appointment, but I've put $10 of my own money on the line. I'm much more likely to show up. Any questions about that? I'm going to give a quick moment to let anyone pop some in the chat. No questions so far. All right, we're looking good. Let's move on to our next little portion, tips and tricks. Here we go. So some of these we've already talked about, but worth reviewing those time-saving tips and tricks. First one, reusing templates. We touched on this, not needing to reinvent the wheel. If someone has a template that's already working for them, it is helpful to reuse those, customize it where it's needed, but not have to start from a blank page, a blank template. This one, we didn't touch on integrated insurance. Some software will allow you to submit claims to a clearinghouse right in the software. So you're not having to leave, go into a new system. You can manage all of your claims, all of your submissions, all in one spot. Treatment plans, that's an interesting one. That is a component of charting. And what that allows you to do is build out a treatment plan for a specific symptom. So that client who came in, who has the shoulder pain, they are able, we can say that they need 8 treatments to probably feel better. So we are going to set up an 8-session treatment plan. All right, next, dictation, another great feature of electronic charting. Dictation, it allows you to essentially speak. If you're not a super fast typer, you can use a dictation tool to speak instead of type. Keyboard shortcuts, I mentioned this one. This one allows you to save those phrases. So DOB to date of birth, any of those repetitive sentences that you're typing, we can save those as shortcuts. And finally, online booking, probably my favorite time saver. If you have online booking, if you make your availability known online, your clients don't have to email you to ask, when are you available? And then you email them back, I'm available this time. But by that time, their schedule has changed. So online booking saves you time, saves them time as well. All right, we have a question here. Can you search your database by symptom or chief complaint in case you remember you had a patient in the past with a similar condition or problem that you want to look at? Love that question. That's something that we can use treatment plans for. So if I go into one of our patients and I go into their chart and I set up a new treatment plan, I might call it shoulder treatment and add in a diagnosis code. So I'm gonna go hashtag search all codes, lower lumbar pain, and typhoid fever. Not exactly shoulder pain, but you get the gist. By creating that treatment plan, actually, let's edit that plan. We can specify the number of visits. So we suggest that they come in for 8 visits. If I hop to my reports, I'll have a dedicated treatment plans report. And I can search by diagnosis code. So I know that someone else has had shoulder problems. I can come in and search by these codes to find the other clients that I've treated with those problems. Great question. I'll give a quick moment for any others. All right, looking good so far. So if you're interested in some more content from Jane, we do have a free magazine and a podcast under the name Front Desk. You're welcome to subscribe via the link on the screen down here. We focus on sharing tips from practitioners. So what has helped them in running their own practice, that kind of stuff that you don't necessarily learn while you're learning practically how to do the job. We'll cover things like how to have conversations about raising your fees, how to handle no-shows, how to prepare for tax season. Those are all topics that we've covered in Front Desk. Okay, I very much appreciate you all giving me your time. That's been quite generous. All Pacific College grads do have access to a grace code that gives them 1 month free for Jane. So do feel free, sign up, give it a try. Non-commitment, you're not putting any of your money down. Try it out for a month, see if it saves you time. The code is PCHS1MO, but if you forget the code, no problem. Just reach out to us at the Jane team. Say, I'm from Pacific College. I know there was a code. I don't quite remember what it is, and we'll be happy to provide you with that. Okay, as promised, a little more time for questions. So if there was anything that you saw or didn't see that you'd like for us to revisit, do feel free to type that out. If there was anything in the system that piqued your curiosity that you want to take a little bit of a further look at, do feel free to pop that in the chat.
In the meantime, I just want to say thank you so much, Lauren, and thank you, Jane.
Of
Thanks again to
course,
Rob
thank you.
Nadeau, our operations manager, and Julian Ruiz, our tech host, as well as Megan Walker from Jane. We did record this webinar, so you can review it again later on the Pacific College YouTube channel. And for those who couldn't make it, it will be available on the Pacific College of Health and Science YouTube channel. If you are a Pacific College grad, there'll also be a link to this in PCAN, the Pacific College Alumni Network, and our practice management resources. If you RSVP'd for this webinar, you will get a thank you later this week with contact information and the offer from Jane. Thanks again for being here. We'll see you next time.
Absolutely. Thank you so much, Cynthia. Right, we'll give that a quick moment just in case any more questions pop in. Otherwise, as Cynthia says, we so appreciate your time today. If tonight you think of a question, you didn't think of it now, feel free to reach out to my team as well. Happy to answer. Always happy to talk to students, new grads, alumni, some of our favorite folks.